Good evening and welcome to the Inter-American Conference of Social Security. From the Inter-American Center of Social Security Studies, we welcome you all. We have now 78 participants and we thank you, all the people who are going to be speaking today in this very important forum. Today, Dr. Gwendolyn Bravo Zurita, Research Coordinator, is with us, as well as Dr. Diego Terán, Specialist of the Aging Commission, and Dr. Jorge Ordelin Foz, Specialist of the Juridical Social Commission, and who will be in charge of the coordination of this activity. Today, we are going to share you a study that was made as an effort of Oxfam, Claxo, and CS on drug price transparency as an effective mechanism to counteract state capture in health policies. This study brings us a very important validation of the actors that are related to transparency regarding drug price, and that we all recognize that we've been looking for all the medicines, and that the price is one of the parameters to measure the health services. So having a drug price transparency requires some studies, analysis, and participation of several actors that are related from when the medicine is generated, all the change of distribution, and finalizing with the cycle with how the user is acquiring the drugs. So during the pandemic, the COVID-19 pandemic, this was very evident. There was a special surveillance worldwide over the related with public policies. In this sense, this study has very important conclusions that you will be listening directly from the experts. Today we have as a moderator Dr. Diego Terán, who is specialist of the American Commission on Aging. Dr. Terán has studied his master in demography by Colmex and economics by the Zacatecas University. His research has been related with the migration, international migration, Mexico, the US, the population transformation, and the demographic growth, as well as indicator design on inequality in Mexican population. His research associated in project associated with institutions such as CIDE and University of Zacatecas. He has been doing a consultancy as well as he having a wide nowadays he is specialist on the American Commission for the Elderly at the Inter-American Center for Social Security Studies. And we are present today because the research area has the characteristic of that the researchers make a multidisciplinary collaborative work. So nowadays we are delivering this product of research that, as I told you at the beginning, has been accompanied by Oxfam and Claxo, as well as CS. Dr. Terán has the floor. Thank you very much, Doctor. First of all, good day for everyone. It's a pleasure having you with us and presenting this document that has emerged after the Claxo in its scholarship of the research state capture promoted as well by Claxo and Oxfam, made a calling in which the Inter-American Center of Social Security Studies in co-authorship with Dr. Jorge Ordelin and I, have made a document called Drug Transparency as an Effective Mechanism to Counteract State Capture in Health Policies. Precisely as Dr. Corrales has mentioned, we lived in a totally historical context. We have been part of history in the sense that we've been living one of the phenomenon that has had an impact worldwide, such as this pandemic. And we are in a historical context where vaccines were created in a historical time. Vaccines that was made by several pharmacies and which has approved by the, and one of the callings of this, one of the objectives of this calling is to see the inequalities on distribution in all the countries. One of the mechanisms that eases that all the inequalities from within and among all the countries is a very important issue, the drug transparency prices, because this helped that the states make a good use of the public resources, despite the existence of patents regarding research. We cannot forget that state has a strong participation supporting some research projects, especially regarding the research of these vaccines that was aiming to stop the COVID-19 pandemic. We thank all the institutions that promoted this scholarship, and especially all that are participating in this panel, because this work was nourished by the dialogue and interaction between several institutions in order to ameliorate this document. I would like to give the floor to Dr. Teresa Arteaga, who is from the Latin American Council. She was helping along the process and accompany all this process. We welcome you and we give you the floor. Thank you very much. Congratulate you by this so important initiative. We are very happy that all the scholarship promoted from Claxo made an impact beyond the report or the academic production, but also could be disseminated under these circumstances and modalities. I would like to highlight that this calling, COVID-19 pandemic, drug price transparency as an effective mechanism to counteract state capture, highlight a very important relationship between Claxo and Oxfam that has been enriching since several years ago, always with an axis state of state capture. This time, we were very interested in what was the pandemic. Latin America and the Caribbean countries have been experiencing privatizations in public services even before the beginning of the COVID-19 pandemic. With the pandemic, we have been experiencing unemployment and hunger and climate crisis that is affecting our countries. As a response, some countries started to make some social protection packages, but clearly these policies were not enough, leaving a great amount of population without any social security and forcing poverty, the increase of poverty in the region. At the same time, we have presented the concentration of the wellness, that meaning that the rich became even more richer. Facing this reality, Claxo and Oxfam has generated this calling We have been having interinstitutional meetings because the thematic was really important. From one side, we were interested in explaining state capture and the privilege that was cross-cutting within the pandemic in two fields specifically, in the economical field and in the environmental field. Clearly, the project that they are going to present that pertains to the economical field. I would like to tell you that we have launched this calling and 30 attendees respond the calling to be evaluated by an international committee made up by 11 experts. After all this process, this long process of evaluation, we have reached a conclusion. Can you hear me? Yes, indeed. So I continue. Where we had finally decided for 4 projects, one from Cuba, intellectual property in COVID-19, governance study and redesign of public policies and legislation. 2 projects from Argentina associated to the environment, climate governance in the context of Anthropocenic in Latin American and Caribbean countries. The other project, collective experiences of politic transplantation in favor of the territorial and gender equality in Latin America and the Caribbean, and the one that we are going to listen right now. That is going to present it. Juan Diego Terán and Jorge Luis Ordelin presented drug price transparency as an effective mechanism to counteract state capture in health policies and innovation, sanitary innovation. It is important for Claxo, all the thematics that has been promoting. We have a pedagogic logic in meaning that all the researchers study accompanied by a tutor. In this case, Dr. Gerardo Ordóñez has been tutor of this research project. It is a pleasure to be here now that the research project has finished, and at Claxo web pages, you will have the summary of all these projects. I would like to put the link in the chat box that are already published. And surely we will publish the collective books with all these 4 chapters. Thank you very much. And thank you very much, Dr. Teresa. Indeed, we are going to share at the chat box, but also at our social media, we're going to share the links so you can look all this material. Precisely, we are going to present the research work developed, and it's going to be presented Dr. Jorge Ordelin. So Dr. Jorge Ordelin Font is a specialist of the American Commission Social Juridical Specialist of the Inter-American Center for Social Security Studies. He is researcher of the National System of Research SN1 postdoctorate at IMED faculty in Brazil. He is also a doctor in juridical sciences by the National Court of Scientific Degrees of Cuba. He's a magister degree in intellectual property from the regional master's program offered by Austral University, Buenos Aires, sponsored by the World Intellectual Property Organization, He also has a master in civil law by the Havana University, guest lecturer at the World Intellectual Property Organization. He has publications in books and magazines in countries such as Cuba, Spain, Colombia, Argentina, Venezuela, and Mexico. He has conducted research stayings at the University of Valencia, Pablo de Olavide University, the University of Alicante, Spain, IMED, Brazil, and the Institute of Legal Research of the National Autonomous University of Mexico. So I give the floor to Dr. Jorge Ordelin. Thank you very much. Good evening to everyone. Thank you very much to be connected and be here at this webinar. I would like to thank all the institutions that directed all this research. We are very thankful for Oxfam and Claxo for this project, because we believe that that it tackles a very fundamental issue in our daily day-to-day, such as inequality in Latin America. For the Inter-American Center for Social Security Studies, these are topics in which, by our research, especially the impact of the drug transparency price had in the social security systems. For us, was really a pleasure to be participating in this calling. A special thank for Dr. Gerardo Ordóñez, because it has been a collective work and all the tutorship by Dr. Gerardo has been really helpful, and directly having into consideration all that is related with the participation that has all the institutions such as Claxo and Oxfam. I'm going to share my presentation. Why do we have to talk about drug transparency prices? So we work on what does it mean, the state capture in health policies. We have considered, or we think that exists some other possibilities, not only studying the phenomenon, but how can we tackle it? How can we counteract? How can we reach that this situation it's minimized regarding state capture? And this is one of the mechanisms. We don't mean that is the only one, but the drug transparency is a mechanism. How can we implement, or how can we reach, how to know the real drug price? And in this context, for example, we were very attentive on how I cannot share my presentation, but I will try to do it as and I will try to explain it as better as I can. How was the vaccine process? How much does the state has invested, and the private companies, and how is the relationship between state and the companies? And nowadays, it's not we don't have transparency in this matter. As of May 11 of 2020, a total of 11.59 billion doses of COVID-19 vaccine have been administered worldwide. We are facing the pharmaceutical problem most profitable worldwide. For example, Moderna's profit margin is 70%, while Pfizer, the benefit is up to 43%. Moderna received a financing of $10 million into Moderna turned more than 10 million of US government funding into nearly 12 billion in profits. It is estimated that in general sense, big pharma pockets more than $1,000 per second from the vaccine business, charging governments 24 times of the cost of generic production. In all of this analysis we don't have the amount of money that the state has invested. So we believe that is very important. Also, public's the social security systems, organization, NGOs, they have to be conscious on how those drug transparency could help not only to know the price, the real price of medicines, but also because why does it is important? Why does Latin America, in the context of medicine production, must know how much is invested, not only as a access of information access, but also to foment, to promote the several speeches that have been made up. We will make 3 cases that of course had limitation regarding data, but concretely, how was the prices? A first debate that we make in the studies analyze the consequences or the relationship between transparency and information access. And we believe that it's interesting that the people who are studying this topic, we are trying to change this speech. When we speak as transparency, we speak as the point of view of making effective access information, and that being possible that several people, you could see this information. But this is limited because only public institutions, governments are the ones who has the duty of price transparency, leaving behind private institutions. So this also have a context between public institutions and private institutions. Transparency is also an obligation of private institutions, that because they are delivering public services. We have to justify that while more transparency, we will reach that the market is not only more transparent, but also that answer the real needs of the population, especially the relationship between the public and the private, that in some institutions, it's very necessary, specifically in the pharmaceutical industry. We have to be having into consideration something really important. We have to rethink drugs as a public asset. Why? Because medicines normally are essential part to the right of health. Why is it important? Because transparency is an exercise of the public function. The fundamental access is availability and accessibility. The state does not have a capacity to produce, and they have to work together with the private companies. But the problem is that the state has been captured by the private sector, and they have also only the capacity of administrate all the medicines. Competencies in medicines cannot be dealt the same way as other products. Why? Because we are not talking as any product. We are talking about a product that is helpful and that is basic for the exercise of a fundamental rights, such as health right, is mandatory, that is constituted as part of the state's obligations. Another aspect that is important is that when we talk about price transparency, we have to understand that the synergies and the strategies, what is going on in pharmaceutical companies is much more complex. And it goes beyond the prices of the medicines. We also have to talk on transparency of all the process, not only the price transparency, all the process of how the medicines are made. How does those medicines, who approves those medicines? How does it are going to be commercialized? And how does it, the consumption and the dynamics related the consumption of that medicine? While more transparency are we in this, all the change of production, we are going to be better in taking better, we are going to fall in what we are living today. Because what happened regarding COVID-19 vaccines, it's a expression of what is going on every day in the pharmaceutical market. We don't know how the medicines are determined, how they are approved, what are the data of this. And all of this is interrelated with two main tensions that we have tried to explain in the study. The tensions between the justification in intellectual rights and confidential information. We think, or we conceive, that when transparency in medicines exists, there will be an impediment and a vulnerability of intellectual property rights. So we have to start changing that idea and revert that situation in which we have been. Why? Because intellectual property right necessarily does not bring more innovation. Besides, an innovation system in general, specifically in pharmaceutical subject, there is it's not a direct relationship. There are all other elements that are inciding. We don't know with certainty how much of the state investment we managed to make a really innovative product. How much of this product is really executive innovation or susceptible of being produced? There are also another matter that is important with confidential information. And it has been analyzed in transparency organisms that they cannot be enough transparent because evidently we have to respect intellectual property rights and confidential information when they haven't having to the consideration that the general rule is transparency and the exception is the confidential information. Not because a medicine, a specific medicine is confidential, it must accept that is from this characteristic and does not exercise a right of transparency. There is a resolution that we cite in Spain case, particularly. Actually, it's a more polemic case, and the court end up saying it is not fundamented. Why does you have to keep this information as a confidential? Because who said that the information is confidential? They have to justify why this information is confidential. This is not, we are not including and assuming within our sanitary policies. And when we talk of sanitary policies, we have to take into consideration the different actors that are intervening in the execution, implementation, and planification of these policies. Because if we don't take this into consideration, the development will not be properly done. What we do in this study? How does health systems are going on in the 3 countries that we studies? Only to having some data of the relationship that in Brazil case, for example, it has the unified health systems that is universal up to 2021. There were 4 ways in which the vaccine could be available. Nevertheless, when you visit the transparency portal specifically, you realize that the contracts are not there. You cannot find a contract. You can only find the total amount of money of money that has invested in buying the vaccines. So I'm not being really transparent. It's a partial transparency because we don't know, and this is a correlation. How much does it was invested, or how much does Brazil has spent in one dose, and if this dose really responds to the GDP, to the relationship of the unified health system, having to consideration another element that is fundamental and that is important. The amount is only referring to buying the global buying without taking into consideration how much are they spending in subminister, in acquisition, and these are some of the main problems that who are the main importers in Brazil. For example, in Brazil, Pfizer, AstraZeneca, Janssen, and none of these are products a Latin American origin product. Despite Brazil, in some cases, can have some innovation on technology. In Costa Rica, was almost the same. We have into consideration by the transparency, government transparency, and that portals that are related with vaccine, COVID-19 vaccine. And what we find is isolated news, isolated information, some information on how the government spent in this matter without knowing how much each vaccine costs. This is very interesting because the pharmaceutical companies say that that the price is justified on how much does the pharmaceutical companies invested in the research. But the problem is that we don't know exactly how much does the pharmaceutical companies invested in this research. Because we have to know why is it important to know this? Because we have to know whether the prices that the pharmaceutical companies are promoting is just or not. Why is it this is important? Because the money is the money of all of us. Because part of our taxes that the society pays goes into this research. And the third study we made in Dominican Republic, keeping the same prototype. We haven't found, there are some countries that are more open than, but in general, in Dominican Republic, we didn't find precise information how much does the vaccine costs. It is important to have into consideration we are talking on official sites and they have the duty of transparency. There are contracts that have signed. Thanks to the journalists, have some contracts have leaked, but in the official sites we couldn't find anything. We are talking not only as access but credibility of the information. We can even make an analysis, a thoroughly analysis related, for example, that Dominican Republic one day authorized the use of AstraZeneca, and at the next day they make the buying. But you don't have transparency in it. You can make some deductions, but clarity on what is going on in this business, what is the relationship between pharmaceutical companies and the state, how are these prices negotiated, which prices were applied to some countries and other prices to other countries. We don't know it nowadays. And I have to highlight, these are official information. What could we say? Two aspects that we are always thinking about: the lesson learned of these studies, we have to see this as an integral policies, especially to deconstruct, to trying to change this speech that has been using, specifically this correlation that more relation that whether more transparency, we have more access to information, because when we have more transparency, we would have more power in the market. And the limitation is the second one. First of all, the data access. That was the first limitation. In the first version, we wanted to make a comparative analysis. We couldn't do it. We have to do a case analysis because there is no homogeneity, so we cannot compare. We have to take also into consideration that even though we say that it is a partial transparency, we are talking that the vaccine has the vaccine against COVID-19 has been the product that has even the more transparency in the prices. So we can imagine other kind of medicines that we don't know that much and that their prices are rising. We have also to take into consideration the impact that this has in health systems, but in general on all society. We're talking state capture. We're talking that you are giving less budget to help other needs. And of course, we are talking of the majority prices, not only not the individual prices, because we know that in the majority of the countries, the vaccines was applied freely. And I finish with a phrase that is a basic phrase regarding transparency. This was publicity is precisely as a remedy to social and industrial diseases. it is said that sunlight is the best of the disinfectants. This is said by a judge at the tribunal. Thank you very much, Jorge, for the presentation. You are going to have access to this document in order to deep in some of the aspects of the document, precisely as Jorge was saying, from the economical perspective. Within innovation, one of the motivation for is a economic rentability that is behind the research. But precisely the perspective that we shouldn't take into consideration is that the markets does not work as it should, because we don't have all access to the whole information. Information comes differently. We cannot be negotiating or lacking the value of transparency in some medicines, such as the vaccine 19 for the COVID-19. So these compromises are a fundamental right of health access. The first vaccines that started circulating in the world were at the last days of 2020, and the percentage of population that has had access to vaccine is not 100%, and it's been more than a year. So we are going to give the floor to Dr. Gerardo Manuel Ordóñez, tutor of this study. He was exchanging information and comments. So I'm going to present Dr. Gerardo Manuel Ordóñez Barba, who is a researcher in the Department of Public Administration Studies at the Colegio de la Frontera Norte. His PhD in Political Science by the University Complutense of Madrid. He obtained his degree with cum laude. Since 1990, he has been a researcher of the Department of Public Administration Studies at the El Colegio de la Frontera Norte, where he currently serves as its director. In 2002, he was awarded the Dr. José Gómez de León distinction for having won first place in the category of doctoral thesis in the competition on education, health, and food program organized by UNAM. As a result, his thesis resulted in the book Social Policy and the Fight Against Poverty in Mexico. In 2002, he specializes in the study of welfare systems in Mexico and Latin America, particularly in the analysis and evaluation of social policies and programs to combat poverty. In 2003, he joined the National System of Researchers, currently at level 3. He's a regular member of the Mexican Academy of Sciences and a member of its award commission, and a full member of the Academy of Sciences of Baja California. He was a founder of the Mexican Network of Social Policy Research and co-coordinator of the Working Group on Poverty and Social Policies of CLACSO. Doctor, welcome. We give you the floor. Thank you very much, Diego. A good day from Tijuana. Good evening to Mexico City, Buenos Aires, and all of those countries where you are following this transmission. First of all, I would like to thank CS, her director, Dr. Daisy Corrales, and Doctors Jorge Ordelini and Diego Terán for inviting me to comment this study that Dr. Jorge has presented. But before saying anything about the report, I would like to refer myself on what my opinion this scholarship Glasgow Oxfam represents, from which this study emerged, and I was tutor by around 8 months. First of all, that I would highlight of this Oxo-Claxo scholarship is the themes that has proposed in the several callings, always around state capture and the relationship with on economic, social, and political, gender, generational, ethnics, or climatic inequalities that historically has marked Latin America and the Caribbean. In the 3 editions, in the moment, we have looked to promote research among young academics within the region to demonstrate that state capture by economic elites, whether national or transnationals, as well as the political elites or even militaries, has been the main cause of the perpetuation of inequality patterns that we are facing in our countries, but also to make evident the inequalities. We also look to promote changes and created interested by groups that has benefits by decades of all the privilege that its economical and political power promotes. These Claxo Oxfam scholarships are very important in academic and social regards for Latin America and the Caribbean. Following with this focus on the thematic pertinency, in the last calling, it stated to analyze state capture in the context of the COVID-19 pandemic and its effects on its economic and environmental inequalities. Diego y Jorge stated a relevant problem in health systems in the region that has charged a lot of importance in this pandemic times. Drug transparency prices as a mechanism to counteract state capture in health policies, and also to promote the access for the population to medicine to just prices, especially for those who didn't have any protection from the health systems. For example, the commercialization of the COVID-19 vaccine in 3 Latin American countries, Brazil, Costa Rica, and Dominican Republic. The results of the research demonstrate that opacity in the handling of information is the rule of the bargains of each country with the main pharmaceutical, making more vulnerable all nations that has a health system and a technological innovation that are weaker. Agreeing with this study, another study of Oxfam exposed that this pharmaceutical that has benefits with tax exemption and suministral contracts have established a monopoly that they control as they like, imposing the governments and prices that overpasses even more 24 times of the prices of its production, regulating the suminister of the vaccines with a tendency that replicates that are replicated in the poorest countries, attacking the trying to make patents and deviating its profits to fiscal paradise to avoid tax payment. Nevertheless, even the research of Jorge and Diego take as a reference the commercialization of the COVID-19 vaccines. Its conclusion and recommendations can be extrapolated to a lot of other medicines, drugs that are very important and that are protected by patents and property rights, but that results so pivotal importance for the health in our populations, such as they are stating in their conclusions. Transparency in the cost and the price of medicines is a public interest matter that cannot be exempted. But this exception shouldn't be in the power of negotiation of in pharmaceutical industries, not the income of the citizens or the general well-being. I just want to congratulate Diego and Jorge for the effort of these past months, because this study is very well fundamented and makes evident the capacity of big pharma companies to impose conditions to states and maximize profits. It's their own profits, mainly at the cost of for the population, at the detriment of the health population. Thank you very much. Thank you very much, Dr. Gerardo. Precisely, you are putting to consideration all these synergies for all the states that has to satisfy a demand. Precisely this scenario, this world scenario in the COVID-19 pandemic that we are living, you put a lot of topics over the table to, for example, to propose transparency, because drugs are not as other assets that are regulated by the market. As Dr. Ordóñez was stating, there are some labs that impose prices that are not defined by the patents or by the involved investment. And precisely when the states receive the value of these medicines, they have to be aware that they are also contributing by investing in this in research, especially researching infrastructure, extension, tax, etc. So I'm going to give the word to the Doctora Gracielle Curcio de David, who is Regional Coordinator for Economic Justice and Inequality at Oxfam Latin America and the Caribbean. She has a PhD in Economic Development at the State University of Campinas, Brazil. She's a Magister in Health Economics and Public Health at the University of Brasilia, Brazil, and she's a specialist in health law at Oswaldo Cruz Foundation, also a specialist in bioethics at the University of Brasilia in Brazil. Doctora, you have the floor. Hello, it's a pleasure to being with you and have the opportunity It's a pleasure to be being with you and have the opportunity to listen this study. I would like to thank Claxo to make the scholarship for this investigation. We managed to have very good results, such as this research, where we find a very good opportunity to have a good study and to disseminate it and advance with policies in transparency themes and economical justice in health and vaccines. This study brings us an opportunity to make a big leap. When the pandemic started, all were desperate to have a treatment, a vaccine, a prevention. And when the vaccine arrived, everyone was happy. So everyone was saying, we have to guarantee the buying of all the vaccines. We have to vaccine all the population. And that is fundamental. We have to save lives. But now that we advance in the vaccination process, there is a moment, and this study is very opportune. The process, we have to make a leap on and think, how was the buying of the vaccines? Is being guaranteed, in fact, economic justice in the access of the vaccines. And when we see this study and other situations that my colleagues from Oxfam are going to share with us, we see that no, in a lot of cases, vaccine buying did not guarantee transparency. did not guarantee human rights and accountability. So it's necessary to keep with this process. This study made me think in three special relationships: economical justice, transparency in the process of drug buying, and human rights and equality. In this sense, we have 6 relationships. And we can think some topics that are more specific. For example, how when the transparency in health is bigger, equality is bigger. When we don't have a transparency, the equality is reduced and the inequalities are wider. So the inverse relationship between equality and social justice, as well as the relationship between pharmaceutical and state regarding transparency. If we don't have a equality between state and pharmaceutical companies, you have less transparency. And that was what happens with the vaccine topic. There was not an equity process between state and pharmaceutical. The state has to buy vaccines. People were dying in hospitals. The responsibility of the state was to buying vaccines. By the other side, we have pharmaceutical companies that they are an oligopoly. When we think of vaccines, specifically for COVID-19, it's even more concentrated, their power. So relationship between both, were really inequality. So the pharmaceutical was saying, we don't want transparency in the contracts to buying vaccines, and the states had to accept this, because so when we think transparency processes, we see that there are inequality, specifically in this case that comes from the private sector, especially the pharmaceutical companies. So the states accepting the conditions of the pharmaceutical companies and in political positions, besides accepting these non-transparency policies from a pharmaceutical contracting, they take advantages and corruption processes. For example, in Brazil is the case when we see that the buying of some vaccines were making by some intermediaries using fiscal paradises. And in this fiscal paradise, this was disappearing. Transparency in the rendition, accountability, and social participation are human rights that the state must guarantee. That are in the OPDs, the international economical cultural rights. And if the states does not guarantee transparency and accountability, they are not guaranteeing human rights in which they are obliged. And they could even be judged. So I congratulate the author of these studies and keep doing this kind of research and the strengthening of the research to help the society to guarantee the rights for the people and to the reduction of inequalities. Thank you very much to the researchers, to Claxo, for the opportunity to having such an important topic study in this precise context. Thank you very much, Doctora Graciel. Precisely, I'm going to give the floor to Sofia Montenegro. That after this dialogue and discussions, they are going to share the presentation Vaccine for the People that precisely is a very pertinent and relevant topic for this dialogue table. So we give the floor to Maestra Sofia Montenegro, not without presenting her. She's a political scientist with a master in public opinion and political behavior from the University of Essex. She's a fellow at Data School for Public Procurement and worked for the Abdul Latif Jamel Poverty Action Lab, Latin America. She has an extensive experience in action-oriented research with a social focus. She's currently the regional coordinator of Oxfam and on equality project of Oxfam. So we give the floor to Maestra Silvia. Thank you very much, Diego. And first of all, I would like to thank the participation that CS has gave us to present the initiative of vaccines for the people. And stating the importance of the interinstitutional collaboration, in this case, the research that Claxo and Oxfam has propitiated in order to guarantee this point of views and to get in deep on equalities challenges, as well as the importance of transparency, that I believe is the main issue of this seminar. I would like to present my initiative. So I would like to start telling you a little bit more of People Vaccines. It's a global movement, more than 100 organizations worldwide that are comprised after the beginning of the COVID-19 pandemic. People's Vaccine Alliance has one of the challenges, and it's been growing along these 2 years. So we have three regional chapters: Asian, African, and Latin American, and the Caribbean chapter, which is where we are participating, and we have entitled Vaccines for the People. I believe that connecting with the presentation of today's panel is the importance of generating strategic alliances with the different organizations that were working previously or that were confirmed during the COVID-19 pandemic, and propitiate this need, as Dr. Ordelin was stating in this presentation, the importation of configuring work agendas by all this crisis. Regarding the need of having transparency, to have a quick response of what we were facing, that the vaccine was not existent still. One of the main issue of Vaccines Alliance is generating a campaign in which several organizations and individuals come together to guarantee the equality for the distribution of the vaccines against COVID-19. Something that was done quickly at the ending of 2020 is the unequal distribution that was generating among each countries with a very nationalistic vision, in which each country bargained with the pharmaceutical in order to obtain the major amount of vaccines. So it's a very inequality distribution where rich countries approach the pharmaceutical, and the poor countries had less access and in equal conditions. So People's Vaccine Alliance's campaign has generated different kind of demands. And one of the main one is the patent liberation as a viable proposal that in the idea of the liberation of the patents was a proposal from South Africa and India that was presented in these intergovernmental organisms that is this trade organization in order to accelerate the vaccine generation and that could be fabricated in a national level, sharing the recipes of the vaccine, and that could be able to generate a different relationship, exchange relationship in the regions where the vaccines were generated. The result finished on June 2022, where it is approved, that is been known an unsatisfactorily treaty that does not include the South Africa and India original proposal. It is really important to understand the relationship where there are still no guarantees to generate vaccines, where technologies and knowledge can be shared. That's why it's important regional alliances with organizations that could make efforts on how can we face these challenges, but also to generate new proposals. So the COVID-19 pandemic hasn't finished, despite that in the region we have 70% of people with vaccines. We also know that a lot of countries, especially in the Caribbean and Central America, that they haven't reached this goal of 70% of vaccinated people. It's also important to highlight that the COVID-19 pandemic hasn't had, the vaccine is not a vaccine that avoid contagious. It only reduces the possibility of having a grave disease, a serious illness. So we have to have different strategies to in order to have access to the vaccines in an opportune way. People's Vaccine Alliance is also thinking in what we are thinking in the future pandemics. It's important to highlight that the coalition that is comprised by more than 25 organizations are thinking in the steps to follow. How can we gather effort in order to guarantee that this inequality situation is prevented? Therefore, one of the things that are stated is looking towards the futures. What are we seeing as a monkeypox, smallpox, is an illustrative case on the importance to prevent all the experiences that we live during the COVID-19 pandemic. Something that is important to highlight is our principles. So our principles are the solidarity between the different countries, non-discrimination and equality, which is really important in the sense of how the pandemic have affected the most vulnerable population. So it's not to damage, prevent, and to repair. That's some of our core values. Having as well access, universal access. and to have the perspective of indigenous communities, the intercultural perspective that are very important to include them into our strategical perspective, but as well as our conscious perspective. We have reviewed some specific objectives, for example, to support, to promote a solidarity attitude and the consolidation of regional efforts, as well as to support regional initiatives, avoiding this nationalist view, having a much more regional regard, and to strengthen regional institutions and support the production of vaccines and other drug medicines in the region, so we can have guarantee the access. Some of the organizations, I show you here all the some of the organizations that are collaborating with us, and we have a basic structure in which we take consensus decisions that facilitate the exchange of the different levels of expertise and knowledge among the different experts and institutions. So we also have here our webpage. If you want to go in deep, we will be sharing as well. We have a strategical framework. We have a document as well where we make a resume of this presentation, and also we invite more organizations to approach us, to write to us, to be with us in the work that we are doing. Thank you very much for the space. Thank you very much, Sylvia. Precisely, it is a very important initiative, especially in the concept in which one of the main pillars that must establish in a pandemic context is solidarity, and especially to pursue the well-being of the society beyond economical rentability. Talking of economic justice is a core value, and reaching this equality by drug transparency. So we are now in the session of question and answer session. And some of the questions that have been made is how to generate a way to incentivize dialogue on transparency and other drugs. So how to propitiate it within the national and regional agenda. I'm going to mention some questions, and whether you want to answer, I will give you the floor. Precisely, what would be the series of recommendation of action to promote transparency in the drug transparency prices, especially to avoid that the state is captured in the sense? And a third question that is a little bit linked is on which are the agents from which this must be promoted: civil organization, academia, international organizations. I am going, for example, the synergy that has generated between Clarkson and Oxfam to promote these kind of callings. So we open the microphone if you want to comment. So it's a very complex topic. The first thing that we have to realize is the complexity of the pharmaceutical regard. It's not something easy. And I believe that not only talking about the complexity of the pharmaceutical environment, but also the complexity of our region is very different. in even recognizing the heterogeneity within the region, we choose these countries is because they had a different development as well as innovation in pharmaceutical regard. We cannot compare the same development in innovation and preparation if we make a small study on what has happened with the COVID-19 vaccine. Well, that also happened in other drug innovation processes. So we had to analyze what is our capacity of innovate and product vaccines and in general medicines. So we have to do a lot of things and to state so many things. Some of the participants was saying, so the state has to have the capacity of innovation and production of medicines. What happened in the vaccines issue is that they have a big impact in innovation, but this innovation capacity in Latin America was limited by free trade treaties, because they reach a negative effect in innovations. So when the pandemic started, we face a pandemic with health systems that were unequal, that cannot be compared in the same way, as well as the social security systems that also were different and inequalities. We arrive with fractured innovation systems facing these big pharmaceutical companies. As we were stating, it is very difficult. I need to buy the vaccine, and that you cannot buy it because it's not transparent. We were in a position that, as Graciela was saying, is inequality in the negotiation. But part of being that the bargains are unequal is because the systems are not transparencies, because you don't know how to negotiate. We have to think on the strategies as a whole region. This initiative has a very important role, but we have to go after the research into actions. We have to make conscious the public officials, but also we have to reach that the population, the society empowers themselves in this topic, regarding these topics. We have to start to deconstruct this kind of discourse, and we have to assimilate the problem of corruption. And also we have to analyze what is related with the problem on what are we teaching in the schools, in the universities, how are we teaching it, and evidently to build a regional dialogue. Part of the study that we developed, and it's only a part, we have been analyzing with several institutions from Salvador, from Dominican Republic, Guatemala. There is a proposal, a very interesting proposal. There is Comisca, how Comisca manage the negotiation. Negotiation does not mean that it's perfect, but it's valid because it's based in union and negotiation. If you have more capacity of negotiation, when there are more countries that are united. Pandemic COVID-19 demonstrated is we have to try to highlight multilaterality in all aspects, from negotiation, for example, what is the role and the position of all the participants, because we have to take into consideration that we have political, ideological postures that not always are equal. So we have to try as far as we can to start generating synergies, concrete synergies towards steps regarding social and economical regards, as well as in the communitary perspective, because inequality is affecting all of us, except the big, those who are owners and the big pharmaceutical companies. That would be some of the ideas. Thank you very much, Jorge. I don't know if Dr. Gerardo or Silvia would like to make a reflection on this. In general, it's a very complex problem. It's a very difficult to untie. We have had examples or trying by means of WHO and the COVAX mechanism, for example, to distribute vaccines among poor countries. But it has been limited efforts. The power of pharmaceutical industries is really impressive and very difficult to move. For example, the case of the controversy that has the National Institute of the US. How much powerful can the pharmaceuticals be that the National Health Institute of the US entered in controversy with Moderna pharmaceutical, because not even Moderna could give credits for the support that the government, the institute gave. So it is a matter of an enormous veracity. They don't even want to share the names, not even the profits. And this, if we widen to a bigger number of medicines, we have examples. For example, Mexico wanted to make a kind of break in the commercialization system that when they wanted to do it, the only thing that generated was a lack of administration. So it's really difficult issues, and the state is confronting an economical power that is very, very consolidated, and that has the capacity to control unfold states regarding public health in the different countries, especially in the countries of our region. Thank you very much, Doctor. If Silvia is there and she wants to add something, thank you very much, Diego. Perhaps only to complement what Dr. Was saying related the heterogeneity of the challenges of the region is not the same talking of what is going on in Central America. For example, I'm in Guatemala, and Guatemala is a country with less percentage of vaccine population. We are around the 40%. And for example, the vaccine process has been paralyzed it's not advancing of what could be the situation when we see, for example, in Brazil, for example, that is a country that fabricates and has a possibility of produce their own vaccine, and that has an account with a pharmaceutical industry such as Biocruz, which has experiences, capacities of generating this kind of technologies. So we have indeed a very important difference in Latin America that is very important to highlight, that when we want to make regional propositions, we should face this situation, this unequal situation that has been the different realities of each country. But at the same time, we have to find a unifier element, which is what we have seen with the explanation of this study, which is the lack of transparency. A lot of the countries, I would say almost the totality of the countries has been in negotiations that goes in the confidential process, and we don't know exactly, perhaps only we know some prices of vaccines, of the doses, that is a unique prices, because we have a reality. We can see the general spending, but we don't know how has the cost of the transportation, the unitary per type of vaccine. And because we don't know that prices, we cannot compare whether the negotiation with the different technologies, the different technologies that are the biggest request, we don't know that those negotiations have been equally in the different countries, and as well as in different moments, because now we are in the second or third doses. And this tendency is replicated. The negotiations restart, and the lack of transparency keeps being the regularity. So in all of this, we find elements to being able to make a regional proposal. As Doctor was saying, we have to we need the strengthening of civil society, and us from the People Vaccines Alliances, we are making some proposals to make a pandemic treaty that could reach the WHO, and that also unify what is the demand that we want and the change that we want in order to act in the society. Thank you very much, Sofia. Well, by means of times, we are about to close this event. We're going to leave some questions, not without thanking Carlos Javier, who has been very active commenting in all the participation of the panelists, but precisely to highlight these market distortions regarding prices, regarding the capture of the states by monopolies of the big pharmas. In local topics, the states could act, but what happens when we face matters of multinational companies? Well, precisely one of the routes is to highlight these efforts by means of solidarity, of co-responsibilities, and especially the participation of several countries with a specific objective. For example, in pandemic could be resumed to save the greater number of lives. We thank you all of being participating with you. We are going to share in the social media by CS and Claxo the study. And in this moment, I give the floor to Gwendolyn Bravo Zurita, who is the research coordinator area from CS, to close this event. Thank you very much, Diego. I would like to reiterate all the thanking for the participant and the all those who were connected in this webinar. So as we can see, there are a lot of people that are interested in the topic. And what I could highlight is what Silvia is saying, is the regional unification. This document is directed from CS to the regional unification. Thank Claxo and CS and Oxfam its participation. And we invite you to see all the works that we do from CS. At our social media, you are going to find a lot of research work that could be interesting for you. From Dr. Daisy Corrales Diaz, we thank you all for your participation. Goodbye.